If you or a loved one is living with cancer, you probably have two focal points: how to rid yourself of it and how to prevent it from coming back. You'll get some terrific information today on Cancer Concepts and Complements with Dr. James Belanger. We'll explore natural medicines which may enhance conventional therapies, share cutting-edge research, and offer insight on how diet and natural medicines can play an important role in treating and preventing cancer. The information presented herein is in no way intended as a substitute for medical counseling. Now, here is Dr. James Belanger.
Hello, everyone. Welcome to Cancer Concepts and Complements. I'm your host, Dr. James Belanger from the Lexington Natural Health Center in Massachusetts. Today, we're going to talk about non-small cell lung cancer and natural medicines that can possibly help improve prognoses in people with non-small cell lung cancer. This is the most common cancer in the world right now, and unfortunately, the leading cause of cancer-related death in the United States. And unfortunately, most of the patients, 75% of people, when they find out that they have lung cancer, it's already in a more advanced stage before it actually gives any kind of symptoms. People get some chronic cough that's not going away, or they're getting bouts of pneumonia. They see their doctor and they find out that they have lung cancer, and it's often more advanced. A lot of times, too, it's not even in smokers, too. It's getting more common now to be present in non-smokers, maybe because of air pollution and radon and other issues that are in our environment. 40% of the patients present in that later stage, stage 4. Now, these statistics that I'm mentioning throughout this are just basically for conventional therapies alone. The purpose of this show is to improve basically all these statistics by combining natural medicines with conventional medicines. So some of the statistics that I'm going to quote throughout this show, remember, it's just basically conventional therapies alone, and adding things to it can improve these statistics. But the 5-year survival for stage 3B and 4 lung cancer is less than 10%. So clearly, more needs to be done when just chemotherapy and some of these new targeted drugs and radiation. There's a lot of natural things that show a lot of promise that can possibly improve those 5-year survival rates. We need to put some more money into that. I hate to tell people those statistics, but it's mainly to encourage you to seek all complementary medicines in addition to the conventional to improve on those rates. Okay, so the traditional therapy for patients, there's a variety of therapies now being offered to people with lung cancer compared to 10, 20 years ago. There's a new drug, it's called Erlotinib or Tarceva, that's commonly used, but it's only for a specific population of people, maybe between 10 to 26% of patients with non-small cell lung cancer. There's this compound, it's called EGFR. It's a receptor that's present on lung cancer cells, and it can sometimes have a mutation in it. So it gets mutated, the gene gets mutated, and causes this particular receptor to become overexpressed. And now the cancer can feed off of this epidermal growth factor more readily than other cells. And they've created a drug that can block that receptor and prevent it from stimulating the growth. But it's approved right now for only people that have a certain mutation of the receptor. So all our doctors will test the cancer for that, and if a person has that, then this drug Tarceva can be really helpful. It's been shown to work better than chemotherapy in patients, either as a first-line therapy or as a maintenance therapy. Usually people don't progress on Tarceva until after 13 months, so they take it and things stay good for about 13 months average, versus chemotherapy on average is about 4 or 5 months before it starts to progress. So if somebody is lucky enough to have this mutation, there's a drug that is very useful for that. But I want to talk about resistance mechanisms. They know that the drug doesn't work forever. Like I said, it works for about 13 months and then wears off. And there's a whole host of natural medicine studies that have been conducted now showing that certain natural things can make the Tarceva drug work longer. So I'm going to review that. There's another new drug that has come out recently called Crizotinib, and it also targets a particular compound that develops mutations in people with lung cancer. It's called the ALK translocation. The ALK is just like a growth compound that influences the cancer. And if there's a mutation in that particular gene, there's this drug called Crizotinib that can be useful. But unfortunately, only 3 to 7% of patients with non-small cell lung cancer have this particular genetic abnormality. But if they do, the Crizotinib is good. It keeps things stable for about 7.7 months average, versus if that same group goes on chemotherapy, the chemo might only work for about 3 months. So Crizotinib is a better first-line therapy in somebody that actually has this ALK rearrangement. But this, again, resistance develops, and there's some research. This is a very new drug, but there's some research showing that certain natural medicines can help prevent the resistant mechanisms to this Crizotinib and make it work longer, so that it might improve on that 7.7-month progression-free survival. Patients that do not have the EGFR mutation and are not qualified for Tarceva and are not qualified for Crizotinib are offered chemotherapy. And there's a whole host of chemotherapy regimens that are offered. But standard is to use this particular drug family called the platinum drug family, Cisplatin or carboplatin, and pair it with a whole variety of different drugs, from a drug called Alimta to a drug called gemcitabine, and other drugs, Taxol, vinorelbine. And sometimes they combine it with a drug called Avastin. Well, it's a pretty standard thing that if a patient has an adenocarcinoma lung cancer, that's one type of lung cancer, that they're given carboplatin, that's one chemotherapy drug, with this drug called Alimta, because there's some research showing that works the best at helping to prevent progression of the cancer. And in patients that go on that, the overall survival is 12.6 months on that particular regimen. Again, that's just with the chemotherapy alone. And then there's another drug that they've compared it to called gemcitabine. It doesn't work as well as Alimta, about 10.9 months. So it's a pretty standard practice that anybody who has this adenocarcinoma of the lung that doesn't qualify for the Tarceva drug or this Crizotinib drug are given cisplatin or carboplatin with Alimta, because of this one, or there might be a few studies showing that Alimta might work a little bit better than gemcitabine or Taxol or some other drugs that have been studied. I am a proponent of doing what's called chemosensitivity testing in patients. We've talked out about some of the other shows that there's this lab called RGCC in Greece that you can send a blood sample to, and they will isolate cancer cells from your blood. They'll grow them in the lab, and then they will mix those cancer cells with a whole host of chemotherapy drugs, including Alimta, including gemcitabine, and cisplatin and carboplatin, and other regimens like Taxol, vinorelbine, and see which regimens work best against your cancer. There are these studies showing that as a whole, this Alimta drug might work a bit better for some people with adenocarcinoma versus gemcitabine or Taxol. But that might not be the case for you. And there's a lab test that can be done that helps determine if Alimta is the best regimen or not for you. There's other types of lung cancers. There's one called the squamous cell carcinoma, and then gemcitabine might work a little bit better for them as a whole. But again, with some proper testing, chemosensitivity testing, you can figure out what's the best regimen for you. So I highly recommend that than to just go and do Alimta, because it works maybe a couple months better for a group of people. There's another drug, it's called Avastin, that they often will use in patients that don't have the squamous cell cancer, that have the adenocarcinoma, as long as they don't have any bleeding history or coughing up blood. And it can add another couple months of medium survival to that regimen. But instead of just taking this Avastin drug, there are some tests that can be done to see if you qualify for that. There's a blood test called the plasma VEGF, vascular growth factor. And if that's done before a patient goes on Avastin, it can predict if a person can have some benefit from that. But unfortunately, I don't see that test commonly ordered. Some patients are just given Avastin, and that's how it goes. there's this test, plasma VEGF, and there's a research study in Medical Oncology 2012 in China showing that patients had a much better benefit from Avastin, patients with lung cancer, if the VEGF level was below 46. So if it was, and that's a pretty low level, that they would have a better response. Median survival was 25.6 months if the VEGF was less than 46 versus 13 months if it was greater than 46. Better response to the Avastin, that is. So that's a simple test that can be measured, and doing things to make sure that VEGF stays down to keep the Avastin working. Avastin is a drug that blocks VEGF receptors, and it's another growth factor. It's something that feeds the lung cancer. If that is present in high amounts, Avastin can have a difficulty blocking it. So there's other things that can be added, like green tea, for example. Green tea supplements can reduce this VEGF so that there's less of it for Avastin to block, and that might help make the Avastin work better. All right, so let's shift gears now to talking about ways to make some of these drugs work better and longer. So this Tarceva drug, like I said, on average might work for a year, 13 months before there's some kind of progression. And they know what happens. What happens sometimes, the cancer mutates this receptor that the Tarceva targets. There's this thing called EGFR that can, change its structure. The cancer can mutate it and change it so the Tarceva is not able to block it anymore. And that's a common cause of about 50% of all resistance to Tarceva. And curcumin has been shown to help downregulate this EGFR and reduce mutations developing it. And there's a research study in China in the Oncology Research Journal in 2014 where they combined curcumin with Tarceva, or Erlotinib it's called, and the cancer, they used a type of cancer that was already resistant to Tarceva, and they combined curcumin with it and gave the Tarceva again. And the combined effect of curcumin and Tarceva was able to start to inhibit the growth of these cancer cells that were already resistant. And this was done in animal studies, so it was at least a animal study, given it orally, curcumin plus this Tarceva drug to Tarceva-resistant lung cancer, and it made it start to work again better. There's some other studies where they add resveratrol with curcumin, and it might work even better with the combination of resveratrol, which is a compound found in grapes, and then curcumin, which is found in turmeric. So some very excited information there. There's another common cause of Tarceva resistance, and it's called MET amplification. So EGF is a growth factor, EGF receptor, that is a growth factor receptor on the surface of a lung cancer cell. So it's like a dock. So in comes a boat, and a boat docks and unloads its goods, and that's kind of what happens, is that epidermal growth factor comes in, binds to the lung cancer cell, and stimulates growth of it. So you block that with Tarceva, the cancer's unhappy a little bit, and then what does it do? It upregulates other docking sites or other ports, you can think about it. So if you block one area, all the boats divert over to a different area and unload there. And on the surface of cancer cells are all kinds of other docking sites. And there's this one particular docking site called MET, C-MET, M-E-T. And there's this growth factor called hepatocyte growth factor that binds to it. And when it binds, it stimulates growth of the cancer cell. So the cancer will upregulate that and lead to resistance. So there's research done in Korea in the journal Lung Cancer 2011 where they measured this thing called HGF, and patients that were high were more resistant to these EGFR receptor blockers. And so that's a simple test that can be done. Anybody that's on Tarceva, you can monitor HGF, and if it starts to rise, you want to do something about it, or do something about it even before it starts to rise. And the thing that is a really interesting-looking candidate that might help stop this HGF and this c-MET receptor is green tea. There's a compound in green tea called EGCG. They think it's the active component. And there's a study that was done in the Clinical Cancer Research Journal 2009 in Louisiana where they gave mice Tarceva-resistant lung cancer. So just like that curcumin study, they already started off with Tarceva-resistant lung cancer, and then they had a control group, and then they gave one group just Tarceva by itself, one group green tea by itself, and one group the Tarceva combination with the green tea, this EGCG thing from the green tea. Well, the Tarceva didn't work at all because the cancer was already resistant to Tarceva, so there was no shrinkage in the cancer at all. There wasn't even shrinkage in the green tea group by itself, but the combination shrunk the tumor by half after 22 days. So, and what's the mechanism is that green tea inhibits this MET docking site, this receptor, HGF, and that's one of the things. Plus, it reduces VEGF, like I mentioned earlier. So, some really exciting stuff that can be done because the Tarceva can work better and longer for the patients that qualify. It will then hold off on the need for chemotherapy later. The longer mileage you get out of the Tarceva, the better. Well, those are two of the main reasons why people get resistant to Tarceva is EGFR receptor mutations and c-MET amplification. But another mechanism is interleukin-6 and something called TGF becomes amplified. So it's just another, think of that analogy with the other dock. So you blocking one thing over down the road here, just like there's a roadblock down the road, okay, everybody diverts around it, and you still get into the city. So this Tarceva drug is blocking a particular receptor, keeping it from becoming active, while the cancer does things to try to overcome that blockage. And one thing, it will override it by increasing other growth signals that lead to stimulation of the cancer. And one is called TGF, or transforming growth factor. So there's hepatocyte growth factor and there's transforming growth factor. There are other things that you could think of feed the cancer. Well, you can measure transforming growth factor, beta, and there's research done in Cancer Research Treatment in 2013 in Korea showing that patients had a shorter survival with lung cancer if they have a high transforming growth factor in the blood. So if you start seeing that, there are natural things that can start to lower TGF. And by lowering the TGF, it will then lower something called interleukin-6. And interleukin-6 leads to resistance to Tarceva. Before I get into other things that lower TGF, you can also measure interleukin-6 as another thing. And I commonly have seen the Tarceva, once it's started, that all of a sudden interleukin-6 starts to rise in the blood. And if the higher it goes, the more likely the patient is going to become resistant to Tarceva. And there's something you can do to start to lower that. So there's a research study in this journal called Tumori in 2004, where they measured interleukin-6, and yes, the patients have a shorter survival if that's high. So these are some useful things that can be done to help guide. Are you on the right track? Are you going to try to break this resistance to the Tarceva by lowering these things so you can get ahead of it? So I got to take a break right now. When I get back, I'm going to talk about natural things that can lower some of these growth factors.
This is Cancer Concepts and Compliments with Dr. James Belanger. The information presented herein is in no way intended as a substitute for medical counseling. If you would like to find out more about the Lexington Natural Health Center, please visit lexingtonnaturalhealth.com. That's lexingtonnaturalhealth.com. Now, back to this week's program.
Hello, welcome back to Cancer Concepts and Compliments. I'm your host, Dr. James Belanger from the Lexington Natural Health Center in Massachusetts. Before the break, I was talking about resistant mechanisms to a drug called Tarceva. Tarceva is a drug that's used for treating some patients with non-small cell lung cancer that happen to have the particular mutations that make you qualify for this drug. But unfortunately, over time, the cancer can become resistant to it. And so I was giving you an analogy that this Tarceva drug blocks a particular growth factor receptor. So it's kind of like a roadblock setup. And, some people, that's their favorite way to get into the city, and that creates a traffic jam for a little while. But then eventually people find a different route around that roadblock. And that's what cancer cells do, that if the EGF receptor is being blocked, one thing that they will do is amplify another receptor another growth factor pathway, and that can stimulate it. And so I mentioned this one called HGF and CMET. That's one pathway. And then I was mentioning something called TGF, transforming growth factor, and interleukin-6. It's another pathway. Think of another analogy as, okay, your favorite food is pizza. Okay, but there's other food that's available, but it's your favorite food is pizza. And I take away the pizza from you. Okay, well, you're unhappy for a while. You might lose some weight, but then after a while, you start to eat something else, and then you get fat again. So that's kind of what cancer does, is you're taking away this EGF receptor from it. It's not getting its favorite food. It shrinks down a little bit, doesn't grow, and then it starts to use other things to override that. So we want to measure these other things. You want to measure HGF. If it starts to rise, green tea, to try to keep that thing down so that you can't use HGF for a way to override it. You measure interleukin-6 and TGF, and if that's elevated, there are numerous things. So those can be measured, and the first thing that might be useful to use if TGF is elevating and interleukin-6 is elevating is a compound called berberine. Berberine is a compound found in various plants. Like there's a plant called Oregon grape that has it, and golden seal, a lot of people know about that, Chinese gold thread. It's a compound found a lot in the plant kingdom, but it's available now just as a purified substance because they use it to treat gastrointestinal issues, and it's even been studied for heart failure, human studies on it. And diabetes is another thing that has been recently studied and given to people. So it's very well tolerated, and some people get a little nausea, but it's very well tolerated. And there's a study done in molecular pharmacology in 2004 here showing that berberine can reduce that TGF thing that leads to the IL-6 that leads to resistance to Tarceva. And a study done in molecular carcinogenesis in 2011 gave animals equivalent about 2 grams of berberine, a human equivalent. They just mixed it in their food, and then they gave them lung cancer and looked to see how much the lung cancer grew. And in the control group, it grew all the way to 58.9 cubic millimeters, but it only grew to 6 cubic millimeters in the berberine group. And of course, it helped their survival. So and it was just mixed in their food, and it was very well tolerated, something that needs to be looked into for more. There's some other research done on a berberine-containing plant called Mahonia, which is like an Oregon grape. That's the other name for it, Mahonia. Given it to animals with lung cancer, showing that it induces cell death and prevents the cancer from proliferating. That's been studied as well. So that's one thing. And again, you measure TGF, you measure interleukin-6. If it's starting to decline with berberine, then that's a good sign. If it's not, there's other options. Curcumin is another thing, and I've already mentioned that there has been an impressive study showing that curcumin can take erlotinib-resistant disease and make it sensitive to erlotinib, or Tarceva, that is. And one of its mechanisms is it might downregulate the EGFR receptor. But another mechanism is it seems to downregulate this interleukin-6 TGF pathway, and that has been studied as well. And so curcumin has effects on several things that might be useful. Now, a lot of people take curcumin, they read the studies, and they take like one pill, and 500 milligram pill or something. Well, that's not what they've used in a lot of the research studies. Most of the research on curcumin is done in animals, and they're given animals like 8 grams or 8,000 milligrams of curcumin mixed in their food, in their water, that kind of stuff. And the few human studies that they have done have used similar quantities. So curcumin does work well. It just needs to be given at pretty high doses. And it's hard on the stomach, curcumin, unless somebody's used to eating turmeric and curry that is, that you give it in small, frequent doses is what I find works the best. So people take a dose of it, a couple hours later take some more, a couple hours later take some more while they're awake. There's also some better absorbable forms of curcumin that are on the market that might improve results too, but very few of them have been studied in like these animal models. Most of the animal models are done on just plain old curcumin, which is a compound from turmeric, and they've used high doses. So some of the newer absorbable ones might prevent a person from needing as much curcumin. More research needs to be done on that. Other numerous things that might help lower this TGF and interleukin-6 pathway is astragalus. Astragalus is a Chinese herb. They use the root of it, and it has been studied as well. And I'm going to talk about that a little bit later because it also helps the immune system. Angelica, which is a dong guai, it's also called. It's a Chinese herb. There's a study done in Oncology Reports 2012 where they gave mice lung cancer, and then they gave them this Angelica, and then they measured the amount of how much the cancer spread throughout the lungs, the lung cancer, and it was reduced by half in the Angelica group versus the control group. And the mechanism of how it worked was it reduces TGF. It wasn't studied with Tarceva, but the mechanism, how it reduces TGF, might apply to Tarceva resistance. So that would be an interesting study, too. Now, the last thing I want to mention for Tarceva is something called Cisplatin. Cisplatin is a compound found in the seeds of milk thistle. So there's this plant called milk thistle, has these little spikes on it that you might have heard of. It's a herb that's commonly used to treat any issue with the liver, like hepatitis or something, viral hepatitis. Well, it has also been studied for cancer, lung cancer, prostate cancer. And there's this compound that they think is the active compound called Cisplatin. And there's two types of Cisplatin, or Cisplatin. They also call it Cisplatin A and Cisplatin B. Well, there's an interesting study done in the Science Reports 2013 in Spain. Now, this one they gave animals that were resistant to the Tarceva. They had this resistant cancer to Tarceva, and then they gave them Tarceva alone, Tarceva with this Cisplatin or Cisplatin, and then together the combination, and the cancer shrunk by about 50% in just the combination. And actually, the group that got the Tarceva, the cancer grew 7 times the initial volume after 35 days. So because it was already resistant to Tarceva, the cancer grew 7 times its original size in 35 days, but shrunk by 50% in one. And there was actually another part to it. It was it didn't grow at all when Cisplatin was combined with Tarceva. So that's pretty impressive. And they used a lot of this milk thistle, like a 1 gram of it. But it was this compound found in milk thistle, Cisplatin. So that's what more research needs to be done, not just taking some tincture of milk thistle and expecting it to do the same thing. It has to be a concentrate of this compound, Cisplatin, which they have used in prostate cancer. It's pretty well tolerated. Some liver enzyme elevation can actually occur when you take too much of this Cisplatin, but they used very high doses in the prostate cancer research. I've used it in equivalent of 1 gram, and it's very well tolerated. But there are other forms of milk thistle, just like I was talking about other forms of curcumin. There's a form of milk thistle, they call it silifos. It's the Cisplatin combined with lecithin. Lecithin is a compound found in like egg yolks and found in soybean, and it makes this Cisplatin, this compound in milk thistle, a lot more absorbable, about 5 times more absorbable. So that's the one that needs to be researched more. And there has been a study done when they did use a more absorbable form of Cisplatin in animals with lung cancer, and it helped reverse resistance to another EGFR receptor inhibitor called Erisa. So that one is looking very, very promising. Okay, so that's another mechanism of resistance to Tarceva. Then there's something called Axl activation. Axl is another compound, just to think of it as another growth factor, another favorite food of the cancer that becomes overactive when you're blocking one receptor. And there's a couple promising compounds that might help with that. I'll mention one. It's called ashwagandha. Ashwagandha, in a study in Biochemistry, Biophysics, Research, Communications 2014 in South Korea, reduces the AXL protein in lung cancer that was given to mice. And that's a mechanism of resistance. So that's something that might make Tarceva work better as well. They haven't studied them combined, but they find this AXL protein can be overactivated. And the last thing that might make Tarceva work better is a compound found in soybean, genistein, it's called. They're finding that when cancer becomes resistant to Tarceva, that it upregulates this particular pathway called NF-kappa B. NF-kappa B is a resistance pathway that helps prevent the cancer cell from dying. It's like a life support system. If the cancer is feeling threatened, shall we say, by the Tarceva, it upregulates this pathway to prevent itself from dying. And genistein can reduce this pathway, and they've studied this in Cancer Journal 2009, showing that it helps make the Tarceva drug work better by downregulating that pathway. And just soy itself has been shown to inhibit lung cancer. So soy is a good food. A lot of people think soy is bad for them. Certainly you don't want genetically modified soybean, but miso soup, organic miso soup, tempeh, even more organic soy milk and tofu could be a good thing to have. There's a research study in American Journal of Clinical Nutrition, 2011. People have 3/4 the risk if they have soy in their diet than people that don't have any soy. 3/4 the risk of getting lung cancer in the first place. And there's a study done in the Journal of Nutrition 2008 where they gave mice a standardized soy extract and measured growth of the lung cancer, and it inhibited the growth of the lung cancer by affecting something called AKT, which is another thing that gets amplified. So soy can be a good thing. There's something in soy called genistein and something called diazine that might be the active compound. And those are more absorbable in miso and tempeh than they are in tofu and soy milk. Fermented soy products could be a good thing. So as long as you're not allergic to it, soy can be good. It just needs to be organic, non-GMO and fermented. It's not a bad food. It's very good. Most of the cancer studies show soy inhibits cancer, even breast cancer. I mentioned that in one of my shows. Okay, there's another drug called Crizotinib that only 3 to 7% of people with lung cancer have the genetic mutation that allows them to use this drug, but it's shown to be better than chemotherapy in those that have that. But unfortunately, the cancer does become resistant, usually after about 7 or 8 months to this Crizotinib drug. And the mechanism of resistance that they know is that the cancer amplifies another pathway called insulin growth factor pathway. So this Crizotinib drug affects something called ALK, which is, just think of it as another food that feeds the cancer. And if that's being blocked and taken away, then the cancer upregulates some other pathway to override that, and that in this case is the insulin growth factor pathway. So they've done studies where they measure insulin growth factor receptors, and those that have higher amounts of that insulin growth factor receptor leads to Crizotinib resistance. Well, genistein, that same compound that's found in soybean, has been shown to downregulate insulin growth factor receptors. Resveratrol, found in the grapes, has also been shown to affect that. Bitter melon, it's something that looks like a cucumber with spikes on it that they eat in China, has been studied for this. And something in celery and parsley called apigenin. Crizotinib is a very new drug, so they haven't used these things combined with Crizotinib, but these things affect the resistance pathway that gets amplified in patients on Crizotinib. So it looks these might be promising agents to add to that. Because Crizotinib is not going to work forever, and we need to do things to help make it work better for longer. So chemotherapy is put on back burner for as long as possible. Avastin is another drug I mentioned that's sometimes paired with chemotherapy for those people that qualify for that have adenocarcinoma without any bleeding history. It's a drug that blocks another growth factor called VEGF, vascular growth factor. And I mentioned that there's a blood test called the VEGF, and if it's too high, over 46, the Avastin might not work. If it's less than 46, the Avastin could work better. Well, a lot of people actually, the VEGF is higher than 46. And VEGF, if it's too high in the blood, it will, should we say, dilute out the Avastin, push it out, override it. Like enough cars pushing on a roadblock eventually bust through the roadblock. So, if you take away some of these cars, then this Avastin can block better. And green tea is something that can reduce VEGFs to a lower level, so Avastin doesn't have to work as hard blocking it. So we already talked about green tea makes Tarceva work better. Green tea is looking really promising for making Avastin work better. Okay, now we talk about chemotherapy. The main chemotherapy family that's used to treat lung cancer for those that don't qualify for Tarceva and Crizotinib is the platinum drugs, cisplatin and carboplatin. Cisplatin might work a little bit better, but does have some kidney toxicity. Well, but unfortunately, these drugs, even after an average maybe 10 months, if you're lucky, they start to wear off. And they know how that mechanism happens. And so there's a whole host of natural studies that have been done on things that might help inhibit those resistant mechanisms. And one study that was done in the International Journal of Oncology in 1990 in Austria showed that something found in onions and apples makes this cisplatin work better at killing lung cancer. It's called quercetin, Quercetin. And a study they gave, it was another animal study, they gave them lung cancer, and they gave one group cisplatin, and they did 3 treatments of cisplatin by itself. And then they gave another group cisplatin with this quercetin stuff, not from onions, but they used a concentrated extract of quercetin. And then they stopped after the 3 treatments, and then a week later they measured the tumors, and they were 1.5 times bigger than they were at start in the cisplatin group. So the cancer still grew in this particular study after a week of stopping cisplatin, and it was 1.5 times bigger. It was certainly even bigger in the patients or the animals that didn't get the cisplatin at all, but cisplatin, it still grew. When they added the quercetin, it didn't grow. It was the complete same size as it was at the beginning. So it achieved a stable disease. And on top of it, it reduced the kidney toxicity of cisplatin. So I use quercetin all the time. People take it for allergies. It's very well tolerated, something that needs further study. Okay, I'm going to take another break, and when I get back, I'll talk about more natural things that can make the chemotherapy work better. This is Cancer Concepts and Compliments.
This is Cancer Concepts and Compliments with Dr. James Belanger. The information presented herein is in no way intended as a substitute for medical counseling. If you would like to find out more about the Lexington Natural Health Center, please visit lexingtonnaturalhealth.com. That's lexingtonnaturalhealth.com. Now, back to this week's program.
Hello, welcome back to Cancer Concepts and Compliments. I'm your host, Dr. James Belanger. Before the break, I was talking about a compound called quercetin that can make cisplatin work better in animal models against lung cancer. Well, there's been a few other natural compounds that might make chemotherapy work better. There was a study done in people with lung cancer using aloe vera combined with cisplatin and another chemotherapy drug called etoposide. This was a study published in Italy in the journal In Vivo in 2009, where they gave a group of patients with lung cancer just the chemo alone, the cisplatin and etoposide, or they also used this other drug called vinorelbine, and then they gave them the chemotherapy plus 10 milliliters 3 times a day of an aloe vera concentrate. There's something in aloe vera called ace-mannins that might help the immune system respond better to cancer. And there's also something called anthracenic acid that is found in aloe vera also that might inhibit the proliferation, the growth of lung cancer. So that's why they decided to study it. And sure enough, they actually measured 3-year survival, and the group that just had chemotherapy alone had a 5% 3-year survival. Those that did aloe plus the chemotherapy had a 20% 3-year survival. So that was really impressive, and that was done by Dr. Lissoni, who's also done a lot of research on melatonin. Melatonin is another thing that he published a similar type of study, taking lung cancer patients and giving them chemotherapy or giving them chemotherapy plus this compound melatonin, which you probably heard of as something that helps you sleep. But they find that melatonin also affects that EGFR receptor that I was talking about with Tarceva, that when melatonin binds to its receptor on cancer cells, it downregulates the epidermal growth factor receptor, so stops that from becoming active. So that's one reason, one mechanism of how it might work. Melatonin also might help our T cells, some cells, immune cells that help fight cancer. Well, in the Journal of Pineal Research in 2003 in Italy, took 100 patients with metastatic non-small cell lung cancer, gave them a chemo regimen, the cisplatin with etoposide by itself, or cisplatin and etoposide plus 20 milligrams of melatonin, and no patient on the chemotherapy group was alive after 2 years. but 30% were alive at 3 years in the melatonin plus the chemo group, and 6% alive at 5 years. So, but none were alive in 2 years with just the chemo alone. See, so some of these statistics were just chemo by itself, and then when you add just this one simple compound, melatonin, that improves survival. Throw in aloe, throw in other things, doing lab tests to help determine that things are looking good. A patient doesn't do as well when TGF is elevated, for example, or IL-6 is elevated, or VEGF is elevated. Well, I just mentioned all kinds of natural things that can help reduce these things to starve the cancer of other growth factors that it likes. Then you couple it all together and you could get possibly some better statistics than just these chemotherapy alone. That's why people need to do a combination of natural things with conventional therapy. To rely solely on conventional therapy, unfortunately, it's not a cure for many types of lung cancer. And, certainly more research needs to be done for sure. But the research that has been done so far is looking encouraging. And unfortunately, the cure isn't out there for lung cancer. So we have to kind of go into a gray area and combine things with the drugs, using lab tests to guide us to help try to improve these statistics to lung cancer. Okay, now let's talk about the immune system. Lung cancer, why is it growing and becoming so advanced by the time a person finds out about it? How come the immune system isn't seeing the cancer? Well, one of the reasons why is there's cells in our body called macrophages, and they're like Pac-Men, and they go around and they just kind of chew up, cancer cells. You can think about it like that way. Well, they can be inhibited. They can be inhibited, for example, in people that have like a high sugar diet, a lot of white flour. There's a research study where they took people and they measured the ability of these macrophages to engulf things, cancer cells, infectious agents, and they were inhibited in patients that had a glass of orange juice because of all the sugar that's in that, or honey, or maple syrup, white sugar. So when you have a big dose of anything that has any sugar in it, our macrophages can't engulf things as well. Do that, day after day, that might be a reason. Well, that's a common thing that happens in people with cancer, lung cancer, including that they call it the phagocytic index of macrophages. The ability of the macrophages to engulf and chew up cancer cells is often low. Well, red ginseng has been studied in the journal Environmental Toxicology and Pharmacology in 2011, where they gave this to animals with lung cancer, and it increased the ability of the macrophages to chew up the cancer by almost 400% compared to the control value, and that decreased the tumor volume by 30%, just that alone, by helping the immune system see it better. So if somebody has a good response to chemo or Tarceva and the cancer starts to shrink down a bit, or it's removed surgically, then you're taking something for your immune system to, should we say, chew up the rest of the cancer that the chemo or the surgery or the radiation wasn't able to take away or reduce. So, but that's the thing. That's the biggest issue, is that there is no approved immune therapy for lung cancer right now. It's basically kill some of it with chemotherapy or starve it with drugs like Tarceva or Crizotinib. But the abnormalities in the immune system still prevail and often can get worse with more chemotherapy treatment. You can test the immune system and find out the issues, the imbalances with it, and using natural things like this red ginseng to improve it. Well, macrophages are not the only thing that are abnormal in patients with lung cancer. Another thing is a lot of patients with lung cancer might not generate enough what's called antibodies to the cancer. So we have these compounds in our body called antibodies. They're proteins that land on some foreign invader, like a cold virus or a bacteria, and mark that particular thing for destruction. Well, our immune system should also generate antibodies to cancer cells because they're abnormal. So our body should want to mount an immune response to get rid of them and clear them out. And they find that patients with lung cancer often have low levels of what's called IgG and IgM. And the more advanced the cancer is, the more often lower these particular antibodies can be. Well, there was a study done a human study in Respiratory Medicine 2003, where they measured these IGF and IgM in patients with lung cancer. And the more advanced they were, the more low they were. And then they gave them this mushroom extract. There's a mushroom called the turkey tail mushroom that contains this compound called PSP, which helps the immune system. And so they gave the people a concentrated amount of this PSP 3 times a day. And they just carried the thing out for 4 weeks, unfortunately. But the group, and this was after the patients had already completed 4 rounds of chemotherapy. So after they completed the 4 rounds of chemotherapy and they were advanced patients, they looked to see within 4 weeks who started progressing. And 23% of the patients that were just given chemo alone started progressing. 5% progressed in the PSP group. So I don't know if they carried that out longer, what the results would have been. But the mechanism was it helped increase the IgG and the IgM antibodies. So that's something that can be measured. And if it starts improving, that's one part of the immune system that could be corrected by this PSP mushroom. But it's more complicated than that. There's a lot of parts of the immune system, and you want them all to be working together in order to mount a response. You want those macrophages to chew up the cancer better. You want the body to generate a lot of antibodies so the cancer stands out and becomes more visible to the immune system. And you also want to reduce certain cells called suppressor cells. There's these cells that can surround the cancer that act like guards for the cancer, and they're called regulatory T cells. Regulatory T cells. And if a patient has a lot of these regulatory T cells present in their blood and around the cancer, then the immune system, the killer cells that is, cannot attack them. And there's research that's been published in Archives of Medical Science 2014. Patients with non-small cell lung cancer have higher levels of these regulatory T cells than normal. In the more advanced stages, the higher these regulatory T cells are. So that can be measured. The Mayo Clinic lab measures regulatory T cells in people's blood. And if it's elevated, a natural compound called astragalus looks very promising. Astragalus is a Chinese herb I mentioned. The root is where a lot of the active compounds are. And in the root is something called saponins. Well, there was a study done in the Journal of Cancer Research, Clinical Oncology in 2014, where they gave animals with lung cancer this concentrated extract of astragalus saponins, and they measured the regulatory T cells, and it inhibited them, reduced the levels of them, upregulated the killer cells, and helped restore that part of the immune system. So again, that can be measured. Those that have elevated levels of regulatory T cells, astragalus would be very useful to get rid of those or reduce those cells that are blocking the killer cells. Okay, then there's these what's called killer T cells that are responsible for killing the cancer. So once you get the antibodies to start to bind to the cancer, that can trigger an immune response, and in come these killer cells. And there's different types of killer cells. There's killer T cells, there's natural killer cells, and they kill cancer just like macrophages can chew up the cancer, but they might not be functioning well. And so there's research showing where you can check the ability of T cells to become amplified and respond to cancer. And there's research showing in the International Journal of Immunopharmacology that a lot of patients with lung cancer do not have very active T cells, that the T cells really don't get turned on, these killer T cells, to cancer. They don't start to expand. They don't really respond aggressively. And that gamma derma or reishi mushroom might help improve that. So that has been researched. Another thing you can check is the natural killer cell function. So there's a test where you can take natural killer cells out of the blood of a patient with lung cancer, and in the lab they'll take the killer cells and mix them with cancer cells in the lab and see how well those killer cells kill lung cancer. Well, it's really common for patients that have lung cancer to have poor natural killer cell function. That's why their immune system is not responding to the cancer, and the cancer keeps growing and growing. Chemotherapy is not going to help the killer cells work better. Tarceva is not going to help the killer cells work better. So when those drugs wear off, the immune system isn't prepared to fight, but that can be improved. You can measure these things and do things about it. There's a study done in the British Journal of Cancer in 1982 showing that the more advanced the cancer was, the more likely that killer cell was to be low. Well, there's a mixture of Chinese herbs, one called sasaray and ponceras, They call it the lychee mixture, studied in the British Complementary and Alternative Medicine Journal in 2009, given this mixture to animals and showing that the natural killer cell activity improved. There's something in safflower, that same thing they make safflower oil out of, that has an ability to increase natural killer cells. There's a whole bunch of natural things that can increase killer cells, but something in safflower has been studied to help enhance the natural killer cells in animals with lung cancer, and that has been studied. There's something in, it's called quake seed or yi ren in Chinese, that has been shown to help make natural killer cells work better. And there's even something in birch bark. There's a study in a Chinese journal showing that they administered an extract of birch bark to animals with lung cancer, and it significantly increases the natural killer cell and prolong the survival of the lung cancer in the animals. So some really interesting stuff. I hope you get a better understanding of other things that have been researched for lung cancer to help improve those results. Next week, I'm going to talk about triple-negative breast cancer that seems to be getting more and more commonly diagnosed. This is Cancer Concepts and Compliments.
Thank you for joining us this week. Cancer Concepts and Compliments with Dr. James Belanger can be heard live every Tuesday morning at 6 a.m. Pacific Time, 9 a.m. Eastern Time on the Voice America Health and Wellness Channel. We hope to see you next week for another show.